name's Lilian Allen. Today I have my dad in the audience, my little sister,
Hello.
and my other little sister. Today I will be talking about increasing surveillance in nursing homes. First, I want to ask, do you or somebody you know have a loved one in or working in a nursing home?
Yes.
I personally do as well.
Okay. I have spent some time working in nursing homes throughout North Carolina, and the difference in care between highly surveillanced homes and not highly surveillanced homes is astounding. There should be more surveillance in nursing homes because it will prevent abuse of patients, help protect nurses dealing with dangerous patients, and let families of patients feel better about the decision of putting them in nursing homes. To begin, it is not easy trying to figure out whether or not to place a loved one in a nursing home. There are many factors to be looking at when deciding. Once that decision is made, choosing the right facility can be difficult due to the wide range of care that is offered by different facilities. When considering which one is right, families and caregivers need to consider the reason the patient is going to be admitted. They need to consider illness, mental disabilities, and physical problems that are associated with old age. There are many types of nursing homes that are available for a wide range of patients dealing with different problems. The safety and well-being of patients and staff is a great risk when proper surveillance is not established in a home. According to Meyer in an article posted in 2016, at the broadest level, more than 2 million cases of elder abuse are reported every year, and almost 1 out of 10 of every elder individuals will experience some form of elder abuse. This is not only physical and mental abuse, there is also just straight out ignoring the patient's need. Many of these cases can go unreported because the patient is either scared of repercussions or physically and mentally incapable of reporting it. When abuse takes place, the trust that once was between the patient and the caregiver and the family is broken and cannot be restored. Abuse inside nursing homes can lead to lawsuits and termination of caregivers and their licenses. According to Grabowski in 2010, over 500,000 persons with mental illness, excluding dementia, reside in U.S. nursing homes on a given day. This causes a very unsafe work environment not only for the patients, the families, but also the caregiver. Many of these patients have a skewed version of reality and sometimes are hostile towards workers. Nurses can be overpowered by patients, and they are both physically and mentally abused. Also, due to the nature and line of work that a nurse or a nursing assistant is involved in with these homes, tasks requiring heavy lifting, bending, twisting, and other manual handling have been implicated in healthcare worker back injuries. These injuries could be avoided if surveillance was put in the rooms and other nurses or nursing assistants could go in and help the one that is in there. So what's the solution to all of this? The solution would be increasing surveillance to ensure the safety and well-being of staff and patients in nursing homes. Furthermore, there's a lot of neglect and improper care, and hidden cameras expose lies and abuse by staff at a nursing home, according to an article posted in 2011. It is truly heinous that senior citizens would not only have to worry about their old age and worsening health conditions, but also if they're going to be treated properly by those entrusted with giving them care. Although there are many misconceptions about nursing homes, members deserve to have a peace of mind and care and services provided to their loved ones while residing in a long-term care facility, according to Franklin in 2013. The well-being of the patient always is a focal point when putting a loved one in a home. But educating people about nursing homes, like the excerpt from the book I read above, can help everyone understand the importance of putting senior citizens in nursing homes. By increasing surveillance, struggles from inside of the room, from not only the staff but also the patient, can be seen and handled in more of a timely manner than what could be done with just normal patient rounding. Not to mention, normal patient rounding isn't always normal. They can go hours without checking in on a room. This can cause severe injuries, falls, those who become more confused with sundowners to get up and try to leave buildings. There have been many cases of old folks getting up from their beds in the middle of the night and leaving the nursing home with no one knowing, and they're in a confused state of mind, so it makes it 10 times more unsafe for them. Although many say that caregivers should just be entrusted with helping these older people and getting them back to good health or helping them get to the end of life comfortably. There have been so many cases of elder abuse and patient abuse and staff abuse that increasing surveillance would only help them. There are many out there that say putting more surveillance in nursing homes is unnecessary. And according to an article published by ABC in 2016, cameras can also have an effect on unduly disrupting a positive, trusting relationship between a patient, caregivers, and family, and can interfere with their therapeutic relationship as well. Even though there are trust issues and cameras are considered to be an invasion of privacy, if the nursing home and staff there are doing everything properly, there should be no concern for having increased surveillance. As for patients who are concerned about their privacy, the footage from the cameras would only be shown to loved ones who are on the patient's HIPAA, which is the Health Insurance Portability and Accountability Act of 1996, release from. Therefore, the patient is not being exposed in any way. In conclusion, there should be more surveillance in nursing homes because it will prevent abuse of the patient, help protect nurses dealing with dangerous patients, and let families of the patient feel better about the decision of putting them in a home. So please, take the time to consider voicing your opinion the next time you're asked about the well-being of patients in a nursing home, because one day that very well could be you. Are there any questions? Thank you for coming to my speech.